In this video, I'll discuss the very real and common problem of an itchy scrotum. What is an itchy scrotum? That means that the scrotum, or the sac that surrounds the testicles in men and in boys, can sometimes itch. Now, there are many causes that can induce itch, or the sensation that you need to scratch over that area. And we'll discuss all of them, and just so you know, it's a very common problem. Most commonly, this happens in older men, so as you grow older, the area can become more irritable and more itchy for various reasons. And the problem of itch can actually make itself worse by inducing scratching. Scratching itself can promote more itch through sensitization of the skin, informing a special type of skin condition that can make the skin more itchy, which is called Lichen, simplex, chronicus, which I'll discuss in a moment. So let's discuss the scrotum. The scrotum is a very distinct area of the skin. It is right below the penis. It is a piece of skin that surrounds the testicles, the male testicles. It has very specific characteristics. It has a lot of oil glands, a lot of other glands, is prone to sweating. There is a lot of hair follicles over the area, and the position of the scrotum is between the two legs. That makes the area very high friction area because you have a lot of moving parts. You have a lot of very closely touching areas of the skin, and that creates a fertile ground for friction. Friction induces irritability or sensitivity, and eventually with enough friction, sensitivity, and irritability, the skin can actually become irritated, as in inflamed, and that can induce itch. Other issues of the area is that it is exceptionally sweaty. And with the combination of sweat, friction, and sensitivity all around, you're actually getting quite the combination to set you up for a sensitive skin area. While it's common, not everyone has itchy scrotum. That has to do with several factors. Sometimes genetics play a role. Sometimes body habitus, meaning being overweight or having exceptionally large thighs, can actually press over the area and increase friction. Other things that can increase the sensitivity of the area involve tight underwear, physical activity, so people who are exceptionally active can have additional friction over the area, naturally additional sweat, and other factors that can irritate it. And then there are skincare habits that can make the area more sensitive, such as washing, scrubbing, using hot water, and applying all sorts of weird things like baby wipes to the area, and skincare products such as creams, lotions, antibacterials, disinfectants, and so on. So let's take a look at some of the major factors that are associated with itchy scrotum. The most common problem that causes itchy scrotum is dermatitis, or irritated skin. Now, irritated skin presents as red areas that are often raised above the normal skin. They're thicker than the normal skin, not by a lot, but by a little. And they're very itchy. They can sometimes be flaky, and with enough scratching, they can actually form sores, or what we call erosions, because of the physical abrasion that can actually knock out part of the skin, disrupt its integrity, and form those sores. Now, what's interesting about dermatitis generally, let alone dermatitis of the scrotum, is that it can happen because of various factors. There's irritant dermatitis of the scrotum that can happen because of irritants, things that can drive the skin into irritability or sensitivity that can form over the area. Sweat is one of them. Then there's all sorts of skincare practices that can cause it. There is physical friction that can cause it, related to underwear or physical activity. So all these things can come together, and they can eventually drive the skin over the edge and form that active irritation. Then there's allergic contact dermatitis, where the immune system is sensitive to a certain ingredient or a product that's applied over the skin. It launches a reaction in response to coming in contact with that ingredient. So that can happen, especially with skincare products that contain ingredients like fragrance, dyes, types of preservatives can induce that. And that can be a major problem, especially with recurring use that can reinforce itself and can actually create a perpetual, a chronic dermatitis that can severely irritate the area and be a big problem. That can be very irritating. So those two major categories that can induce dermatitis can be acute, something that happens over a very short period of time, and they can transition into the chronic phase, which is perpetual. It's ongoing until it's actually addressed and resolved through active measures which require withdrawing the offending agent. First of all, reducing friction and irritation over the area, and then often require treatment actively with a medication. Most of the times topical medications such as steroids and other topical medications will help, but sometimes very severe irritation can require systemic medications. Now let's talk about the one stage above dermatitis, and that is a condition called Lichen simplex chronicus. Lichen simplex chronicus is a form of a chronic skin condition that forms after an area has been irritated long enough and the person suffering from that irritation has scratched the area long enough to induce thickening of the skin and almost a vicious cycle of irritation and itch that continues to linger on. Despite even sometimes withdrawing the initial offending agent, that area will persist. So Lichen simplex chronicus, which appears as very thickened areas of the skin, most of the times they're pinkish or reddish. Sometimes they can be a little darkly discolored, like brownish or even darker brown. So those areas can be very irritating, and the irritation is persistent, meaning you cannot back away from the irritating practices and get rid of the itch. That itch will last unless the area is treated actively to get rid of that irritation and to reverse or at least mitigate and minimize the changes that occurred over the skin for a very long period of time. Other causes of itch over the scrotum, psoriasis is one of them. Psoriasis is a chronic skin condition that can many a time affect many areas of the skin as pinkish or reddish areas that are raised over the normal skin, what we call plaques. And they're usually covered with white thick scale that sticks or adheres to the areas. Over the scrotum area, there may not be scale, but the area may still look reddish and pink. And psoriasis can sometimes itch or even burn. And treatment of psoriasis, again, is not something you can just leave alone. You really have to treat it actively. There are many strategies to treat psoriasis. Check with your dermatologist to see which strategy works best for you. Seborrheic dermatitis is another chronic inflammatory skin condition that can affect many areas of the body, from the scalp through the face, the chest, the armpits, and sometimes the groin, the scrotum, and even the penis. This condition is an idiopathic condition like psoriasis, but it's thought to be caused, in some cases, by sensitivity that the person who has the condition develops to yeast that occur naturally over the skin. Now, this condition sometimes responds to antifungal treatment, and in many cases, because of the irritation that is associated with this condition, it will require topical anti-inflammatories, specifically topical steroids, and in some cases, topical calcineurin inhibitors, as well as other medications. Infections could be another cause of pruritus of the scrotum or an itchy scrotum. Tinea cruris, which is jock itch, or a fungal infection of the groin area with fungus, as well as erythrasma, which is a bacterial overgrowth over the area. Those two look very similar. They can be distinguished by several tests that the dermatologist can do by the bedside or in the clinic, and those tests can tell the difference between those two conditions that are treated slightly differently. Those two infections of the area can definitely lead to irritation of the area and to associated symptoms such as itch. Now, one of the most baffling conditions of the scrotum that does lead to itch is what we call scrotal itch or primary itch. And that is a condition that is not very common, but when it does happen, one must pay attention to it. And that is itch for no reason that we can discern, meaning there's no rash on the scrotum, there's no irritation, there's no infection, there's no psoriasis or seborrheic dermatitis. There may not even be any changes over the skin at all, but the scrotum just the same is itchy. And that condition needs to be distinguished from the previous conditions that we mentioned that have a clear appearance on the skin, have very clear methods of approach, and clear treatments that'll get you relief. If the initial effort doesn't work, you may go to second-line treatment and so on and so forth. This type of condition needs to be addressed very specifically. It is not true irritation of the skin, but rather, we think, is likely related to the faulty nerve transmission, where the transmission of itch is transmitted from the area through malfunctioning of the nerve endings and other factors possibly. How do you distinguish all the other conditions that I mentioned from what we call primary scrotal itch? Well, the way to distinguish many a time, first of all, you have to have an extensive discussion with your patient. You have to take a look and examine and see what is happening over the area. And then ultimately, if you can't see anything with your bare eyes, if your dermatologist cannot see anything with their bare eyes, what they'll end up doing a lot of the times is obtain a skin biopsy. Now, why do we obtain a skin biopsy? Well, there are several reasons. A skin biopsy, first of all, is very helpful in getting in definitive answers for what is going on the skin. Sometimes these are changes that we can actually see, but we need to distinguish them from other conditions that look very similarly. In other times, we can't really see much with the naked eye, but we can still realize that there's a problem and there might be something going on a microscopic level, which the biopsy can help us distinguish as well. If the biopsy shows nothing but normal skin, then our answer is this is most likely primary itch of the area. Primary itch needs to be treated very differently from the previous conditions that we discussed. They usually respond to topical treatment or maybe systemic treatment that addresses the inflammatory or infectious process that led to the symptoms and the appearance of the skin condition. So pruritus of the scrotum can be addressed by many different treatment approaches. See your dermatologist about that if you're suffering from this condition. Another much less rare cause of itch over the scrotum is skin cancer. Specifically, there's a type of skin cancer that is called Paget's disease, or what we call extramammary Paget's. Paget's disease is usually thought to be associated with breasts. However, when it occurs on other areas of the body, it's called extramammary Paget's disease, which means away from the breast. Paget's disease can occur over the scrotum and as a lesion that looks much like dermatitis actually in many cases. It looks like an area that's raised above the surrounding skin. Sometimes it can be pink, sometimes red. There's other forms of discoloration, and that condition can be associated with itch as well. So if you're seeing anything on the scrotum that is itchy and irritated, don't leave it alone. Bring it into the dermatologist, have it evaluated and inspected and examined, and determine what needs to be done. Now, there are plenty of things that you can do on your own before you actually see the dermatologist to relieve your symptoms. And we've discussed these actions in many previous videos. First of all, do no harm. What does that mean? Avoid the so-called cleansing of the area with all sorts of hogwash techniques. Do not use hot water. Do not use strong streams of water over the area. If the area is irritated, I would advise you to avoid soaping and other detergents as much as possible, let alone using any physical abrasives. Those are all very harmful to the skin. Even if they're necessary, physical abrasives certainly are never necessary, but if you need to use some form of soap or a cleanser to address a specific issue, that will still irritate the skin some. And then there's avoidance of any other application of gratuitous topicals such as antibacterials. If you're not sure you have jock itch, you may be using the antifungal and irritating your skin further. And also avoid baby wipes at all costs. These will invariably make irritated skin worse, and they will feed into the problem and make the skin more sensitive, more itchy, and have your problem persist even further. So avoid these things. Another thing that's very important is mind your underwear. If you're wearing very tight underwear and have an itchy scrotum, you have irritation of the scrotum, you want to loosen up your underwear, pick very soft fabric. The fabric I recommend the most is either cotton or silk. Be very mindful that it's a high thread count, or very soft fabric. It's loosely surrounding the area and not pressing very tightly on the scrotum. And the other thing is, if things are very irritated, consider wearing boxers or briefs and wearing them on the inside out so the seam doesn't come directly in touch with the scrotum and make your problem worse. Now, moisturization I usually recommend to many other parts of the body when they're irritated. On the scrotum, it's a little bit of a toss-up because you can end up making your condition worse, especially if it's a condition such as tinea cruris or jock itch, erythrasma as well. So certain conditions may not respond favorably to moisturization. So I'd say lay off the hard stuff first of all. Avoid irritating the area. Be mindful of the underwear that you're wearing. Minimize any friction-related activity to the best of your ability until your problem has been resolved. And then you may discuss with your dermatologist whether it's appropriate to apply a moisturizer to the area knowing full and well that you're not going to make your condition worse. If you enjoyed this video, share, like, and subscribe. Add a comment in the comments section. Let me know if you're suffering from any such condition. What has been your pathway to getting diagnosed, treated, and relieved? More great content coming your way right from this channel. Thanks for watching, and God bless.